Welcome to the Resilience series. I'm Stephanie Weaver, the author of the Migraine Relief Plan and the upcoming Migraine Relief Plan Cookbook. And for that project, I'm interviewing a variety of people on the topic of resilience. And my guest today is Dr. Elizabeth Seng. Dr. Seng is a psychologist, a research associate professor in the Department of Neurology at Albert Einstein College of Medicine at Yeshiva University. Dr. Seng's research is focused on improving management of migraine and painful conditions through modifying behaviors, thoughts, and lifestyle factors. How juicy. I'm so excited to have you here. Welcome,
I'm
Dr. Seng.
Thank you so much. I'm happy to be here.
So tell us briefly about your background as a migraine doctor, and do you personally experience migraine?
So I don't personally experience migraine, although there is migraine in my family, including my husband. I was originally interested in chronic pain, which is a very common story among psychologists. Pain psychology is a large field. But I had the incredibly good fortune of landing in the lab of Dr. Ken Holroyd at Ohio University for my PhD work. And he is really the first person who took a hard look at how lifestyle factors might influence headache disorders and how behavioral treatments might help manage them in combination with preventive medications. So that was the big project I was on in grad school. And really, although I didn't plan on working with people with migraine at the beginning, as I started to meet our patients and realized the incredible number of people with migraine, the huge burden that it can cause in someone's life, and the complete dearth of psychologists working in the disease, I was very happy to continue to work with people in migraine for the rest of my career. So I did my fellowship at the West Haven VA and Yale School of Medicine and landed at Yeshiva University and Albert Einstein College of Medicine in a lab where I train about 8 to 10 PhD students in my lab in headache disorders. So the hope is that we continue to grow the field and that there will be more and more people who will be available to help people who want to undergo behavioral treatment for migraine in the future.
That's great. So let's start with cognitive behavioral therapy. Tell us what it is and how it might impact the migraine disease experience.
Absolutely. Let me start a little bit with how we think lifestyle factors impact people who have migraine. So, one of the big misconceptions that I think does contribute to stigma in the broader cultural ideas about migraine is the idea that lifestyle factors cause the disease itself. And we certainly don't think that. And I think it's an important distinction for people with migraine to be able to make that um, lifestyle didn't cause the disease. This is a genetic disease that is kind of this hypersensitization of my brain, and it makes me really, really sensitive to changes in the way my brain interacts with the world. And so when the weather changes really quickly, my brain just doesn't like that. And when I don't sleep very well for a couple nights in a row, my brain just doesn't like that. When I travel across the country and the time zone changes and everything is just out of whack, and I skip a meal and I drink too much alcohol because I'm at a family wedding, my brain just doesn't like that. So we think of lifestyle factors as mattering when they are things that are outside of the norm for you and your brain. And when you have things that so disrupt your routine, that can lower the threshold for experiencing a migraine attack. So the goal of cognitive behavioral therapy for migraine is to do everything we can to raise up that threshold, to make it less likely that these um, small changes in your environment will necessarily produce a migraine attack. So lifestyle factors might be associated with attacks in people with migraine, but we wouldn't think they're associated with the disease themselves. CBT, so cognitive behavioral therapy, attacks these lifestyle factors in two ways. The first is through behavior change. So for certain things like sleep, um, there are behavioral strategies we can use to retrain your brain to sleep a little bit better. And some of those strategies are kind of easy and fun. Some of them are difficult and not very fun. But at the end, you'll be sleeping better, and hopefully that improves your migraine. Other behavioral strategies that we do with almost every person who comes through are helping people take their acute medications better, or taking their preventive medication every day. Taking your preventive medication lowers or increases your migraine threshold, so it makes it harder for an attack to occur. Taking your acute medications treat the attacks themselves. And many people have a hard time, especially with acute medications. Which one do I take? When? How do I know? That's what CBT is there to kind of help you figure out how to apply the plan you came together with your neurologist in your actual lived day-to-day life. The second part of cognitive behavioral therapy is the C, it's the cognitive part. So when somebody lives with a chronic disabling condition for a long time, it can be really defeating. And we can start to develop thoughts and beliefs about ourselves that are not very kind, and they're not very helpful. So sometimes those beliefs come from inside. A lot of times they come from people in our lives. And the goal of behavioral therapy is to help identify what those thoughts and beliefs are, and try to make them a little bit more helpful, and help you take care of yourself a little bit better, be more kind to yourself as you're trying to manage this really challenging chronic illness.
Thank you for that. And I'll just respond briefly that, I was 53 before I was diagnosed. So I had what I would have described as weather headaches my whole life, probably abdominal migraines as a kid. And it was stunningly shocking news to me that the variety of things that I was doing in my life could have all had anything to do with these headaches that I got. So, when I learned about, sleep hygiene and, being regular with when I went to bed and woke up, and eating regularly and not skipping meals and making sure I was drinking enough water, I was like, that has an impact. And that's partly why I wrote the book, because I was like, I don't think people know this stuff. Like, maybe they've heard about cheese and red wine, but it was just shocking to me that so little of that information was out kind of for the public, when it's 1 in 5 women that experience migraine disease, and 1 in 7 people. So thank you for kind of clarifying all of that. That was super helpful. So you also study day to day, what you call small decisions, and the role that that plays in migraine. So tell us more about that.
So, one of the big kind of disconnects between being a migraine provider and a migraine patient is the migraine provider sees all the decisions about treatment as being made in the office. The patient comes in, they tell, you talk about your symptoms, you figure out what you're going to do, the patient leaves, and everything is solved. But for patients, migraine is a disease that's characterized by attacks. So people with migraine have to make decisions about what they're going to do at each moment based on how they're feeling. And the way I talk about that is that people with migraine, when they step outside the door, they become their own providers. And people with migraine are making medical decisions for themselves every moment of the day, assessing their feelings, assessing their symptoms, trying to figure out, are these warning signs? Is this a prodrome, which is what we call the period of time before the head pain starts in a migraine attack? Or, is this just that I ate, food that didn't agree with me? What's going on? Can I still work? Am I going to be able to drive home if I take this medication? There's so many little decisions. So my lab stepped back and we said, okay, cognitive behavioral therapy, useful, difficult to access. Not every patient's going to be able to get this treatment. It's probably only going to be for patients who show up in general neurology clinics or headache centers. We want a strategy that every, headache app can incorporate in their mobile health apps to improve the medical decision making people with migraine are making every day. So then we asked, well, how do we improve provider decision making? And the answer is through clinical decision support tools that are embedded in electronic health records. So if you're allergic to a medication, your physician tries to put that medication in the EHR, there will be a little reminder that pops up that says, hey, allergy alert, don't give this person that medication. those reminders are clinical decision support. So my lab is trying to use the same idea with mobile headache diaries. So as people are keeping their mobile headache diary, we try to send them small targeted alerts to help them optimize right now mostly acute medication adherence. Although we're also experimenting with stress management, which is much harder, sleep management, which is slightly easier, and then eating consistent meals. So keeping a good, consistent meal time every day. Obviously really small right now. It's going to be the kind of project that will take a lot of partners over a long period of time. But the goal is that it would be a strategy that everyone would be able to incorporate, so that anybody who downloads any reputable headache diary would be able to tap on it and expect to have not just a way to track your headaches, but also a way to improve your management of whatever headache condition you're using the app for over time.
That's great. And I can see, I loved how you described it as, we become our own providers. And in my book, I talk about like um, elevating yourself to the head of your medical team. And because you're the only one that's in your body every day, all the time. And, if I see my neurologist every 4 months, so he can't possibly help me that much simply because I only see him once every 4 months. And he's awesome, but so part of what, and then if people are, if their insurance has rationed their doses, which is very common, you get 9 doses of your acute medication a month. So then that's part of that decision making is this bad enough to use one of those pills? Because what if I have a string of 5 days where I'm going to, and so that's part of what you're talking about, is figuring out. And part of what he told me was, I want you to take it anytime you really think you need it, because I don't want you to lose your hearing, because he's also a balance specialist and I have issues with that. So, it was him telling me, like, don't, every time you have an attack, it's potentially worsening your hearing long term and damaging that. And I don't want that to be, because that's going to be really disabling for you. And I had no idea, right? So that helped me be more adherent. But also, if I was using an app and it was reminding me of those things, that also might be very helpful. So I think this is great that you're doing this. And so um, you kind of addressed this, but I wanted to bring it up because I know there's been so much stigma around migraine. It's a women's condition and you're hysterical and all this stuff, or you're just trying to get out of work, or you just blah, blah, blah. And so there is that danger of it feeling like blaming the victim. If we're just not working hard enough, we're just not doing the right things, we're going to have this attack. So how do you address that, either with patients or with when you're training people, to kind of just deal with that?
Absolutely. The first thing that I always talk about, especially when patients will often deal with this with their family members or with other people at work. So there's a lot of coaching other people to advocate for themselves, but to also help other people understand what migraine is and what it isn't. So one of the first things that we'll talk about is, I'll say, if somebody says, well, you caused this yourself because you didn't manage stress well enough or something like this, to my patient. It's common that people will come in believing that themselves because they've been told that by the media, by their friends, by their family. One of the first things I often ask is, so did you cause your migraine because you weren't taking propranolol or whatever your preventive medication was? Did you cause it because you weren't actively trying to prevent them before they happened? Because it's nonsensical. Of course you didn't, right? Don't confound a cause of the disease itself with the way that we manage it now. When you have migraine, it is helpful to try to lead a really regular routine lifestyle. But there are a lot of misconceptions about how controllable both migraine attacks themselves, as well as any of these lifestyle behaviors are. Stress is not actually that controllable. Uh, stress is very difficult to move. It's one of the reasons I clinically often start with sleep, because although sleep is notoriously difficult to manage, it's actually been a little bit easier for me to help my patients with sleep than it is with stress. Stress is your body's alarm reaction to threats. If you have a lot of things that seem threatening in your day-to-day life, and of course, we're doing this interview in the middle of a global pandemic, there are a lot of things in our daily lives that seem threatening. You just may not have as much control over the situations as it seems like we should. The second piece of stress is our body's physiologic reaction. So most of the things that we do with patients are trying to train your body not to respond so much to these perceived threats in your environment. But that takes a long time. And even once you've really gotten it down, there's just only so much you can actually do. So I think a big part of um, improving overall lifestyle factors and wellness for migraine is recognizing that you are not responsible for your migraine attacks, and that you should choose to focus on some lifestyle factors that you value anyway, that you think will help you feel better in general and will improve your health and vitality, with the hope that they will also reduce migraine attack frequency, recognizing that these are long-term processes, and that it takes a lot of, they're not easy. It takes a lot of work. Don't ever feel like, oh, it's just stress. It's not. It's so challenging to treat any of these things. I think the general public is starting to wake up to how challenging it is for us to really change our behavior in such a way that it impacts our physiology with weight. We're all, as a culture, starting to recognize, gee, there are actually a lot of factors that go into your weight that aren't just under your personal control. And I hope that we start to get to the same place with stress and sleep and some of these other factors that we're talking about. Of course, it's important. Of course, there are things that we can do. And that's why my lab and I, offer treatments to try to help people. But the idea that it's going to be quick or easy or simple, or that everybody should do it, I think that that's a little naive. I think people should choose the things that they're ready to do, that they're excited about, and that they think will help them feel better in general.
Yeah, I love that answer. And part of what I'm seeing is I think that the fact that there's um, more celebrities that are coming forward as spokespeople for migraine illnesses, celebrities that are coming forward for the different mental health apps, that there's so much more acceptance around you know it's okay to not be okay, which is one of the things that Jamie Sanders says. She's the migraine diva. And during the pandemic, just like basic self-care stuff has been really hard. And so one of the things that I've done is I make like a to-do list every day on scrap paper, and it's like walk, meditate, yoga, shower. And then it's like when I finish my shower, because some days it's been like, do I really have to take a shower? Oh my God, that seems like so much work. And I'm like, yay, good job. You did a shower. You took a shower. Because that it's hard, like just feeding ourselves and putting clothes on and getting laundry done. Like, so yeah. So I think that part of what can feel overwhelming is there's so many things. That's why I created an 8-week structure. It's not because I wanted it to take 8 weeks. It's just that it's really hard to get behavior change embedded in your life. And so if you do little things every week, you just have one little thing you're trying, which they are bigger things, some of them, but because I read a ton of diet books, and they're like, okay, so tomorrow clean out your pantry, throw out all the food that you're not going to eat anymore, and then the next day you're going to be on this plan. And I was like, well, first of all, most people can't afford to throw out a couple $100 worth of food. So that's not very realistic. But also, there's like a lot of emotion in that. It's a lot of work. It's maybe the rest of your family's not on board. Like, so I really worked with, clinical nutritionists and people that were experts in this to say, what's realistic to have people do. And they're like, well, if you just did one part, like just the pantry is the first thing, and then you do the freezer the next week, and then your refrigerator. And it's like you're gradually working towards creating an environment that is more conducive to you being able to continue these goals. But I love what you said about picking the few things that you feel excited about, that you have energy around, that you know ultimately are goals that you have that are not just about your migraine experience, but are larger goals. So I think that's great. So let's talk a little bit about pain management. How do some of these strategies impact pain management?
So I want to focus mostly on sleep, stress, and routine life behavior. So keeping a really nice rhythm, which we typically think of as not skipping meals, kind of trying to have about the same amount of activity level every day, some kind of aerobic activity every day. So for migraine, we think of most of these things as trying to increase the threshold at which you would have an attack. So there's some really
And
lovely
I'm just
high
going to interrupt
quality.
you. So
Yeah,
what she means by that is that if this is where your migraine threshold is and you're kind of living down here, then you're not going to have an attack. So the idea is to be living farther away. So increasing the threshold, what she means by that is not your pain threshold. It's where
yes,
you're going to trigger through an attack.
that's
Please,
exactly it.
please continue.
So no, absolutely. So if you think about, there are lots of things that can trigger migraine attacks that you can't control. Uh, you can't really control the barometric pressure changes very well. It can be difficult to control menstruation at any given point in time. Obviously, you can talk to your OBGYN, but uh, there are pieces of your life that you can endeavor to try to manage. So um, stress is the first obvious one. It's also, in many ways, the most complicated because the more we've delved into it, the more we realize that when people say, "Oh, stress triggers my migraine attacks," they are attributing a whole lot of things to stress. So the actual stress response in your body is only part of it. Perceived stress is also how many hassles happened to you that day, how stressful is your day-to-day life, how many burdens do you have on your time right now, how much free time do you have available to yourself. So what we think about with stress management is that it will both increase kind of the pain threshold. It's also for chronic pain conditions in general. Stress management can be useful because it's one of the things we think of as closing the gate to painful sensations. So pain happens in your body, but your brain interprets it. So there are some lifestyle things that you can do to try to interfere with those pain signals. And one of the things that you can do is try to work towards stress management. I think one of the big things that would be helpful for people to understand is that stress management strategies are fairly straightforward ways that you try to manage your body's reaction to stressful situations. Um, there's a new set of tools called mindfulness strategies, and that's a much broader, much bigger task to start to learn how to change your attentional focus and to stop judging the things that happen in your life so much. We're all very used to judging everything that comes our way, and mindfulness tries to help you change what you attend to, what you pay attention to, and how you judge it. And it's potentially a really, really useful strategy. It certainly seems to reduce headache related disability in people with migraine, but it's also pretty challenging. So you don't have to become a mindfulness maven to experience some improvement from basic relaxation strategies.
Great.
For sleep, we like people to wake up at the same time every day. That's the first thing that you do. With sleep, again, it's another thing you can't control when you fall asleep. But you know what you can control is when you get out of bed. So we start with getting out of bed because that's the thing. You know you can control it every morning. And then we work back from there. Okay, can we keep the same nighttime routine? Can we make the nighttime routines really relaxing? Can we get rid of screens an hour before? Can we exercise every day in the afternoon or in the morning, not 4 hours before bed? And we slowly build up to try to get your body used to sleep. For routine lifestyle behaviors, we try to help people eat healthy diets, but eat them consistently. Eat it every day. Don't skip breakfast. try to get the same kind of meals every day. It can be very difficult for people to start to wake and eat at the same time on the weekends as they do on the weekdays. For a lot of our college student patients, this is one of the big challenges is how do I still have a social life while keeping a fairly routine schedule to help with my migraine? And it's a challenge, and it's a challenge that we try to work with people towards, because the more routine you can keep your life, the better quality of life you'll have in the long run. And we help people make decisions about when they're going to break the rules, when it's important enough and it's something that they love and that will increase their quality of life by engaging in it. I've had patients who we practice in New York City. I've had patients who want to go to a Broadway show, who want to go to the US Open, and we'll help them figure out strategies so that when they do go, they can have a wonderful time. They'll be ready for a migraine attack if it happens. And hopefully they've been able to raise their threshold enough that the weird sleep and weird eating doesn't impact them too much.
That's great. So, what role do you think resilience plays in migraine wellness?
I think resilience is a challenging topic because sometimes we think of resilience as something that people have or they don't. So there are certain people, when they hear that word, they think, well, gee, I'm not very resilient, and it's not something that they necessarily identify. In my clinical practice, though, I think that resilience is something that everybody has inside them that they can cultivate and build. Resilience takes focusing on yourself a little. It takes some self-care, and really rooting down and understanding what your values are and what the things are that you think are important to give your time to. I think resilience plays a huge role in migraine management because the course of migraine for many people is not all up and to the right. It's not you get a diagnosis and then you get the perfect treatment and everything is great after that. For many people, there are peaks and valleys, and it can be really difficult to keep going to the neurologist and keep trying the next medication and keep trying the next lifestyle change, or whatever is in your strategy, whatever's in your toolbox. It can be very difficult to keep going and keep seeking treatment when you have experienced a lot of setbacks and when you're in a valley. And I think that's the place where resilience really shines through. People with migraine are amazing. The fact that so many people have migraine in the prime of their lives, when they're going to college, starting businesses, starting families, raising kids, it's amazing how much people with migraine manage to do while dealing with this unpredictable, disabling condition. So I think that where we need to be targeting resilience strategies, helping people realize the need to focus on themselves and self-care, is in these valleys, when people start to experience an increase in symptoms even though they're doing everything right. When when the medication you've been on for 3 years that's been working great suddenly quits working. Like all those times, they're dangerous times in the treatment course. They're times we might lose people, and people might say, well, forget it, I'm just not going to take medication at all, or forget it, I'm just going to stop doing all of this stuff. Helping people move through those valleys, I think, is a really critically important thing for everybody in the profession to do.
Great. So my last question for everyone, and it's always interesting to me how people answer it. So what are some self-care resilience strategies that you personally find helpful?
So every year, I do a couple of worksheets from acceptance and commitment therapy, which is a type of values based therapy that helps you accept. So in pain, it's kind of accept the chronic pain in your life, um, and commit to engaging in um, valued life activities, even though you have pain. So I always do a couple of these worksheets where I say, what are the things that I really value in my life? Spirituality, family, exercise, being active. Um, how much do I value them right now? Because that changes over time. And how well do I think I'm living out those values? And I find where the biggest discrepancies are, and I target no more than two things in a given year. So when the place where the big discrepancy is something in the self-care exercise kind of realm, I like lean back into the exercises I love, like yoga or swimming. When it's things like family, I schedule in family time. So I try to make sure that the strategies that I use are targeted to what I really value in life that year, recognizing that my values may shift over time.
That's fantastic, and no one has answered that way. So I love that I get different answers every time. Dr. Seng, thank you again for being here today and sharing your knowledge with us. Check out elizabethseng.com to learn more about her work. And check out other episodes of the Resilience series on Facebook Watch, IGTV, and YouTube. Follow me at sweavermph to learn more about my upcoming book, The Migraine Relief Plan Cookbook, which is due out in spring 2022 from Surrey Books. Thanks so much for watching.